Welcome back. We're continuing our series of getting to know our new faculty, and I'm lucky enough to be with Dr. Nate Kugler. Nate, thanks so much for joining us today.
Thanks for having me.
It's great to have everyone get to know you a little bit, and maybe we could start. I obviously know you better than most new faculty just because you've been here for, I think, since about age 6 or so. But I'm just joking. But maybe tell us, where did you grow up, and how did you get interested in medicine?
Sure. So thanks for the opportunity to be here today. It does kind of sometimes seem like I've been here since the age of 6. So I grew up in central Illinois, small town, about 4 hours south of here. And ultimately, I'd say my journey in medicine really started when I was a young kid. I remember being a little kid running through the hospital, chasing my dad on weekend rounds. And I think he really was kind of the initial guiding influence in my life and kind of getting me to medicine. I feel like I've sort of been surrounded by it since even before the age of 6.
So what
when
kind
I
of
moved
a
here.
doctor was Dad?
He was a medical oncologist, so really not a surgeon or any real love for surgery, if you would say.
And we lost Nate from surgical oncology to vascular. Oh my God!
It could maybe
I didn't
be
realize
that
Dad was a medical oncologist.
It could be all those years of medical oncology that lost me, but nonetheless, certainly not a surgical approach from my formative years.
Okay. And where was college?
So I went to the University of Iowa. I pretty much was grown up a Hawkeye. My father was a big Hawkeye, and so I was pretty much given one choice really when it came to college, and that was University of Iowa. So spent 4 years there before coming back to Illinois for my medical school at Southern Illinois University.
Yeah. And how were we lucky enough to get you to match here for surgery training?
Well, I would say...
Because we must have been #1 on your match list, right?
You actually were very much one on my match list. So I was very excited for the opportunity.
Haley was going to turn off the camera if we weren't #1.
Well, no, luckily you were #1 on my match list. So I got very lucky, coming up here. One of my mentors in medical school had a very good relationship with the Medical College of Wisconsin back at that time, and had very much encouraged me to spread my wings and kind of come up towards Milwaukee and see what it was like. And I couldn't be happier having spent the last 10 years of my life here now at this point in time, which does seem kind of like the age of 6 on.
Yeah, and the thought and trying to decide what to do when you're a surgery resident, very difficult. I mean, I almost flipped a coin. I was going through all kinds of different specialties. When did you think vascular surgery was the match for you, and how did that come about?
Sure. I mean, I think I've always been one of those people that it's whatever I'm doing that day is the most exciting thing in my life. And it certainly was a tough journey over the 7 years of my general surgery residency to really figure out what I wanted to do. But I'd say somewhere in my 4th year, I kind of really figured at the beginning of this that vascular surgery was my passion. The ability to kind of operate throughout the entire body, like a true general approach, and the ability to create new things was the thing that really drew me to it. And seeing how vulnerable our patients were and the ability and the impact that we could make in their lives was really a special relationship that I saw in the specialty itself.
Oh, absolutely. And now that you have both the component of endovascular and open vascular surgery, it's really traditionally merging 2 different specialties all in one. And as you mentioned, you have to master all the different parts of the body. Where do you think vascular surgery is going to be in your lifetime, even in 5 and 10 years? The technologies are changing so rapidly, right?
Yeah, I mean, I think if you look back even to just the 90s, the mid-90s, the concepts of endovascular aneurysm repair were basically laughed at by a lot of folks, and that's now become the standard of care. It's hard to believe where we'll even be in 20 years from now, but certainly I think it's been nothing but a positive impact in terms of where devices have brought us. The ability to take something that was a 7-day hospital stay and basically turn it to close to outpatient surgery is truly a miracle. And I can't imagine where in the next 20 years we'll ultimately end up, but I'm pretty excited to see where we can be here at the Medical College of Wisconsin.
Absolutely. So the transition from residency to fellowship, and then fellowship to being a faculty member, which was harder, and how would you characterize this year so far?
So I think the transition from fellowship to faculty was probably the biggest jump that I've experienced. Throughout your training, obviously throughout you get a lot more graded responsibility, and you take a lot more ownership on yourselves as these patients are your own patients, and that's how I've always been. I think as a faculty, it's a different experience because they're referrals to you, and you see these folks in the clinic, and you get to spend a lot of time learning about their families. And not only do you see them during the hospital stay, their post-op follow-ups, but for long periods of time after that. I think that's been the most rewarding part of it, and certainly my partners here, who have been a big influence in my life and my career choices, are the reason that I've been so successful, I think, through my first year here at MCW.
Well, vascular surgery is a huge draw for our residents. It's without question the most storied division in the Department of Surgery. Started initially by Jonathan Town, and just had an amazing group of physicians and scientists over the years. Really fantastic. And it's amazing. So on July 1 of this year, or I guess it may have been August 1, all of a sudden you're Dr. Kugler to all of those people who you were just Nate to. Yeah. Now you're all grown up, and people are actually listening to you.
That's
so
true.
Yeah, just like home now, right? You walk home, everyone listens to you. And now at work, everyone listens to you, right?
People may listen to me more at work than they do at home, but certainly I would say it's been an interesting experience. A lot of folks have been, oh, really, you're finally a faculty, because I've been here for so long, and it's been such a great journey over the last 10 years to get to where I'm at today.
Really neat. So what do you do outside of work?
So outside of work, I thoroughly...
And people have to realize that Nate does struggle with some of the Doug Evans challenges of work-life balance, but be that as it may, you do leave the hospital maybe once or twice a week.
I do occasionally. I've been super blessed to have a great family here, and I've been very blessed in the last year to spend a little bit more time with my family in my transition to faculty. And watching my kid grow up and my wife's career bloom has been very much a great time. We do enjoy getting out on the lake in the summers and sort of outdoor activities in the winter, trying to spend as much time outside when I'm not in the hospital, given all the time I spend inside here.
Yeah, oh, that's great, good. Any final comments, any words of wisdom for those people who may be viewing this, especially for residents who may be watching this? What do you think a couple of the keys to your success? Because you have had just really an amazing, not to inflate you too much, but you have had an amazing transition from fellowship to faculty. Really, it's gone so beautifully. And if you had to give one or two pointers to some senior residents, what would you say?
So I think the major pointers that I would say is that achieving a good work-life balance is an important thing. Not that I have clearly mastered that in any stretch of anyone's imagination, but I think the most important thing that you can look at when you're transitioning to fellowship or a job is to surround people who really are passionate about what they do, because that passion will certainly rub off on you as you grow. Make sure you go to a place in a fellowship and whatever it might be, and people that are interested in helping you grow your career. Because when it's fun to come to work on a daily basis like it is here, you don't really actually feel like you're away from home. It's sort of a second home for you. And I think that's the most important thing that makes life and your job a great time. And really that translates into great patient care, I think, because happy doctors, I think, make good doctors.
Oh, so well said. Dr. Nate Kugler, thanks again for joining us, and we'll be back with another edition really quickly. Nate, thanks so much.
Thanks for the opportunity.